Santa Brea. No talking, can you turn around, show respect, make good choices? These people came to help you.
So my name's Miss Jessica. I'm a registered dental hygienist, and this is Miss Jennifer. I'm here with a program called Early Smiles, where we bring dental screenings into the classroom. And so part of our program is to educate you on some ways to prevent cavities in your children. Cavities are the #1 reason why children miss school, and the #1 most preventable disease that children have. So today, part of our program, if you've okayed me to do so, we're going to be screening your children, taking a look in the mouth, assessing them for cavities. We're going to give them a toothbrush as well as a fluoride treatment, and then you'll get sent home with some paperwork about our findings, okay? And if you don't currently have a dental home for your children, then we're here to act as a resource to help you find one. So I'm going to go into a little bit of information, just some of the key points of helping you guys make sure that your children are off to a good start and have really healthy teeth for the future. So does anybody have an idea of why baby teeth are so important? Does someone want to maybe be brave and give me one thing that your children's teeth are useful for? No? No one? Eating? Good. Yeah, the most important is chewing and eating. If they don't have healthy teeth, they're not going to be able to do that. I know all of you can't probably see this board, but some other things that the teeth are important for is they help your children to learn to say words, their pronunciation, as well as helping to hold the teeth for when the adult teeth come in. So you can see this photo here. This is about a 4 or 5-year-old that had some cavities that were left untreated. So cavities can lead to bigger infections, as you see in this picture. They can start to, affect the cheek, the eye. Cavities on baby teeth also make them more likely to have cavities on adult teeth. If they're not feeling well, if they're not in healthy condition, it's going to make it hard for them to eat, sleep, play. If they're not in the classroom, they're really not going to be able to strive and be developing like we want them to be. And if any of you have had to fix cavities for yourself or your children, you know that it can also be very costly and very time consuming. So those are things that we want to prevent for you as well. So here at Early Smiles, we use a little saying to help you remember the 3 most important things to prevent cavities. So we like to make little teeth a big deal. So BIG stands for brushing and flossing daily, being aware of the in-between snacks that your children have between meals, and getting your child's teeth examined and checking them for yourself. So I'm going to go into those 3 things a little bit more detail. So the first one is brushing and flossing twice a day. Most of you know brushing twice a day for 2 minutes for yourself and your children to ensure that you get all the teeth. As soon as the teeth come in, you can start using a small amount of fluoride toothpaste, and small amount meaning a grain of rice. So if you're only using this little bit, if they do swallow some, it's not going to upset their stomach or harm them in any way. And then as they get older and they start to get more of their adult teeth, you can graduate them to a little bit more with about a pea size. Same thing for yourself. You never need really more than a pea size of toothpaste. So I know that you see the commercials where they put the big old blob on there. That's just them trying to take your money. So, you just need a real little bit. And then always try to make brushing fun. Let them go to the store, pick out their toothbrush, incentivize them, have a fun timer, sticker charts, things like that. So that way it keeps them interested in that. Next, and probably the most important, especially at this age, is going to be the diet and the nutrition. So to be really aware of the things that are going into your child's mouth and the things that you're bringing into your home. So just like your body likes healthy snacks, so do your teeth. Your teeth like fruit, vegetables, dairy like cheese, yogurt, and as well as proteins like beans and lunch meat, turkey, things like that. So cavities are caused when there is an acid attack on the teeth. And acid attacks happen when things like sugars or carbohydrates are introduced in the mouth. So sugars would be things like fruit snacks, candy, and carbohydrates are things that are starchy like crackers, graham crackers, goldfish, pretzels. Anything that's a carbohydrate also breaks down into sugar. You also want to be aware that fruit juices, and even milk have some amounts of sugar. So I urge you to kind of look throughout the day at your child's diet and be aware of these acid attacks. So for example, sometimes they wake up in the morning, they have a glass of milk. There's acid attack number 1 because the milk does have some sugar in it. And then you give them, maybe a snack, maybe, I don't know, someone tell me what you gave your child for breakfast this morning. Oatmeal, good. So oatmeal, which is good, the grains are really good, but sometimes you have to be aware that the oatmeal may have added sugar into it, so that could be acid attack number 2. And then maybe when, they get to school, they have something else, you may have some toast or what kind of things do you
They
give?
have fruit, they have milk, and they have protein of some kind every
Okay,
morning,
good.
grains.
So that's good. So when you have things like, breads and sugars, you always want to try to complement them with something healthy. And then encourage the child to sit and eat the meal at one time rather than grazing on the food. Sometimes I know you'll kind of put, maybe a little bowl of crackers, they'll come take one and then go play for a little bit and then come back. Just be aware that you're expanding that acid attack over a longer period of time, so that's going to increase the risk of them getting cavities. And then last, you never want to use food as a bribe or a reward. Try to use things like stickers or incentives. This contributes to their overall nutrition as well. And last but not least, you want to get your child's teeth examined by a dentist, dental professional. The rule is by their first tooth or their first birthday, which means everyone in here should have had a dental visit already. So if you haven't, then that's what we're here to help you do. And just be mindful that these visits aren't going to be like how your visits are. They're to get the child exposed to the dentist, make it a fun environment before, if there is an issue in the future. So I tell people, just like you would have a medical doctor that you're comfortable with in the case of an emergency, so would you want to have a dental professional, because God forbid they're on the playground and they fall and they hit their tooth and now you're both kind of frantic and you have no one to turn to. But if you but if you have someone that you're comfortable with, it makes the experience a lot easier for you. You always want to check your child's teeth at least once a month. When you help them brush is always a good time. The children, in my rule, and usually they say about 6, but sometimes it can be a little bit older. Until they can tie their shoes on their own, they probably can't brush their teeth on their own either. So you want to still be helping them make sure they're going over all the areas of their mouth, and that's a good opportunity for you to see if there's any white or brown spots, because those areas are not normal. Those are first signs of cavities, and you want to have those checked out. Okay, so make sure you put your child's name on the front of the paper and answer this, and then now I'm going to flip it over and we're going to go over the correct answers, okay? So snacking throughout the day can increase the chance of getting cavities. That one's true, so make sure you circle it on the back side. Begin toothbrushing only after the baby teeth come in. That one's false. You want to make sure that you're brushing as soon as teeth come in, even before. If you have little ones at home, they're being bottle fed, breastfed, you still want to wipe the mouth out, and then as soon as those teeth come in, you start brushing. You don't wait for all of them to come in. The third one is it's okay for children to have juice or milk right before bed. That one's false. You want to make sure that brushing their teeth is the last thing that they do before they go to bed. Juice should always be diluted, so about this much juice, this much water, just enough to kind of sweeten it for them. And then milk, when they're starting to unwind for the evening, you want to give them the milk, and then have them brush their teeth, and to get them to go to sleep, do something soothing like rocking them, singing to them, reading to them, rather than pacifying them with the bottle to go to sleep. The fourth one